The next time one of your patients comes in complaining of a tight hip flexor, tight hamstring, I want you to check these two things first. The first test I want you to check is their modified Thomas. Have them go into a little ball and drop one leg down to the table. If that leg is hitting the table comfortably, it's unlikely they have a tight hip flexor. The second test is an active straight leg raise. If their straight leg raise is greater than 80 degrees, it's unlikely they have a tight hamstring. Now, if these two tests come up negative for range of motion issues or tightness issues, it might be a strength problem somewhere in that range. Sometimes it's in the short range, sometimes it's in the long range. Now, it's a little difficult to show you how to do manual muscle testing or muscle test these two muscle groups without a partner. I'm going to show you some solutions so you can kind of take the principles from these two exercises and apply them to your clients if they're coming up with weakness or inhibition issues in these muscles. So to go after the hip flexor, maybe there's some weakness in that long range, we're going to use the monkey foot. You can use a kettlebell for this as well. You can hook that on the top of the foot. That works really great. A high table, I like to try and get that opposite glute really going. But if you've got a high surface that you can support the client with, maybe your treatment table, it allows that hip to get into that full range extension. Now, when I'm setting this up, start them in that short range here. Get them into a little bridge. They're setting that right side of their pelvis into stability, or into some better control. Posterior pelvic tilt, abdominals are on, and we're just going to slowly lower down. Now, angle yourself across the table so I can post up with that opposite elbow. So I'm connecting the right or the left shoulder with the right glute to activate that posterior sling here. So as I have some good stability on the opposite side sling, I can get that hip flexor to pull through. Now, it's really important that I don't let my spine drop into extension because that's just going to cause some pinchiness. Make sure the abdominals are tilting that pelvis into a better position and there's no pinchiness in the low back. So I get a nice stretch at the end here. I can contract the glute, let it hang, and really pull up and through. And then even come up into a little higher bridge with the opposite hip here. And you can feel that glute really firing up. Because remember, the hip flexor on one side works contralaterally with the glute on the opposite side. So we're working on that cross pelvis stability and control. To go after the hamstring tightness, we're just going to go into that deep lunge. So we get that extended arm, we get that knee behind the hip. Again, we're getting the core on. I've got that glute foot activated on this side. And we're going to do some leg curls here. Now, the interesting thing is I've shortened the hamstring at the hip, but then I'm also bringing it into a short range. Ooh, in that fully hip extended position. So we're shortening it at both the hip and the knee. And if the hamstring's not used to this, it might go into a little spasm. So don't stay there too long, real slow on the way out. And as the client finds a little bit more range, I can get over top of that toe a little bit more and pull that up. So I'm making sure I don't want to go into any pinchiness in the low back, keeping the glute contracted, keeping that core locked down, ribs are down. And I can use something like a Liebert bar to press down to activate the lats to add a little bit more stability in the upper ribs here. Now, you don't need a monkey foot. I like the monkey foot. You can add various weights in this. Most of your clients probably only need a little ankle weight or a light kettlebell that you can get away with for the hip flexion and the knee flexion exercises. If this was the problem, go back and check the work. Check the range of motion, see if that feels tight still, but then go back and check your manual muscle tests and see if those switch back on. Because oftentimes, it's not weakness, it's inhibition or a lack of control through a specific range. And the brain just needs to be able to find those muscles again to stabilize the joint and get them switched back on. If you want to sharpen up your assessment skills, head over to amtcertified.com. Learn how to use manual muscle tests as a feedback loop for your effectiveness to really know if you're making meaningful changes with your clients.